So I have your questions here. I'm just going to wing it. I'll list the question and then answer it in a relatively succinct manner. First off, I'm very proud of you for doing this project. I hope we can be helpful. Your first question was, how do you measure success or improvement in chronic pain cases? Um, I think the answer is twofold. We do a lot of research here, so there's certain measures that we administer that are often predictive of success post-discharge. And then there's also just more qualitative, like what do we look for as clinicians that would indicate that someone is improving. So from a research perspective, we look at functioning, and that's patients' perspective on functioning. We look at, and I'm talking psychologically, we have, I think you asked PT and OT themselves. We look at how much worries about pain have decreased and fear of pain has decreased, because we know through research that if kids become less worried about pain and less fearful of pain, are more likely to function with it. We look at depression and anxiety, which isn't necessarily something that as a psychologist I feel I need to see decrease by the time of discharge, because sometimes getting back to life can be anxiety provoking, so those scores can go up, but it is nice to see if those go down. I'm trying to think of what the other measures are that we look at psychologically. And most of it is subjective, meaning that like it's the patient's perspective on how they're doing. From a qualitative standpoint, and as you know, our goal really is, and our short-term focus is on functioning. So is getting back to school, getting back to extracurriculars, getting back to socializing with friends, having parents feel like they know how to help their kid best and most effectively, are all indicators of positive improvement. And also that pain has faded into the background of their mind. So at first follow-up, it's not so much that pain has decreased, but more that I'm just not noticing it as much. That kids are better at pacing and coping with pain. And have, from my perspective, begun, because we have a lot of really high achieving kids, begun to prioritize their body and their mind and their mental and physical health over like getting the best grade. And this is like, I'm sure we talked about, given your experiences at Boston Latin. So that's the answer to the first question. The second one is, how does chronic pain affect a patient's motivation or self-image? I think, it depends on the kid. I think sometimes if a kid has had pain for a really long time, sometimes pain becomes very central to their identity and their self-image, meaning like they've lost connection to other parts of themselves that make them interesting, and that pain becomes really kind of a focus. And I think that's one of our goals too, is to try to get kids to diversify how they feel about themselves. I think it also can cause some kids to begin to shift their focus on the parts of their lives that they can control. So for example, if they were really like excellent athletes and they have some kind of lower extremity pain, they can't play their sports, they over focus on academics. So I think sometimes it can be like a shifting in their self-image. And then motivation, it really, again, it could be a little bit of like, I can't do what I want, so I'm going to throw in the towel, and so I'm not going to do anything at all, like kind of an all or nothing approach. And some kids, like I said, shift their focus and over invest themselves in a different area of their lives and are very motivated. So it really, again, it's a lot of my answers are going to be, it depends, but that would be my answer to question 2. How do you support patients who are frustrated or losing hope? Which also is going to fold into your next question, which is, what role do mental health strategies play in your treatment plans? So I think a lot of us here, a lot of the psychologists here, focus on both cognitive behavioral therapy and acceptance commitment therapy. And the acceptance piece, that it's called ACT, is very much focused on like accepting the struggle that you have with your life as it is and figuring out what you're going to do with the cards you've been dealt. So I think when we're talking about frustrated or losing hope, it's validating, like, that makes sense. You've had to give up parts of your life because of pain. And also, like, what are you going to do given that that's the circumstance that you're in right now? And how can we either like modify our goals, shift them, change them, and recognize that, one of the metaphors in ACT is that like life is like the weather. So, you know, you're the blue sky and like things are going to happen in your life that are cloudy or rainy or stormy or sunny. And like, how do you manage what's given to you? So I think when we're thinking about frustration, it's a lot of validation and also shifting the perspective that you haven't lost the ideal, is to sort of change what your ideal is so that it fits your current circumstances. Um, and then mental health strategies. I mean, we're obviously using all different, I will say, research wise, cognitive behavioral therapy has been the most researched in addition to acceptance commitment therapy for chronic pain in kids. But we use a whole tool bag, depending on what the kid is struggling with. We use also some like family systems approaches, given that, as we have a big family and parent component. So like, how do you get the whole village to help a kid with chronic pain? But, I'm always folding in tools, mental health strategies into treatment, but it really depends on what the kid is bringing. And there's, obviously, to your next question, which is how does chronic pain intersect with anxiety, depression, trauma? It highly, obviously there's a lot of intersection, and what I'm sure we talked about when you were with us, but is that the nervous system, which is the second largest organ in the body, it like does emotional things. It handles like emotional feelings, and it also handles physical feelings. The nervous system has a lot of jobs, and so when you have anxiety or when you have depression, or if you have a history of trauma, whether it's acute, like just a one-time thing that happened recently, or something chronic, it amps up the nervous system. So the nervous system, is a little bit more red hot. And if you have chronic pain too, those things are going to interact because it's going to inflame, the physical parts of your pain. And so, if we can settle down some of the anxiety or the depression, or manage at the PPRC, we're not necessarily going to treat a lot of trauma because that's a whole nother type of psychology, and a little challenging to try to hit on while you're here, but to handle the nervous system windup that happens with kids who have trauma, to be able to have strategies to manage that, because it will indirectly help your pain. So the intersection is biological. It's also psychological. If you're depressed or you're anxious, you're not going to have the capacity, if you're severely anxious and depressed, to be able to cope, because you're kind of at your wit's end, right? Like you don't have the like space to be able to manage pain. And so that's why we often will treat anxiety and depression with, the mental health strategies, those strategies I described, but also often seeing our psychiatrist. If there is a biological, oftentimes if you've had pain for a really long time, there's going to be a biological effect of that, with serotonin in your brain. And so it's important to treat that as well, because if we can settle down the nervous system that's dealing with the mental health stuff, it will probably make it easier to manage pain, and even maybe turn the volume down on the pain. What therapeutic approaches, I think I've talked about that, have been most effective in improving pain perception. I mean, it depends on the kid too. I'll offer usually different approaches, because some kids are going to take to CBT and some kids are going to take to ACT. Mindfulness-based strategies are folded into both of those approaches. And I don't personally do a lot of biofeedback, but there's clinicians in chronic pain that do biofeedback, and relaxation approaches. There's a lot of different tools that can be effective with chronic pain. But I will say, on top of it, the uniqueness of the PPRC, where I can rely on my other team members to be able to handle the physical, PT and some of the occupational aspects of pain, makes my job a lot easier. So if you're an outpatient therapist doing this, it can be hard if someone's got severe chronic pain, and I feel very lucky and fortunate to have my team. How do you help patients rebuild trust in their bodies after long-term pain? I mean, I think part of it is a little bit of like see it to believe it, meaning like I think a lot of kids, even if pain doesn't improve in the short term or even in the longer term, like it takes a while, like seeing that you have efficacy to do the things that matter to you in your life with pain. And so you begin to trust like your ability to handle the pain more than trust in their bodies to function correctly. There's a little bit of just like validation that your nervous system isn't working great. And then there is like a very large proportion of kids who come to our program who do experience pain relief and just showing that your body can respond. Also, sometimes post discharge, kids will have an ankle sprain or something else that happens that like their body heals normally. And so to show like your body can do it, it's capable of healing and functioning in a normal way. So it's got that capacity. And also, for as much time, if this is not someone who's had pain for their whole life, like your body knows how to not be in pain too. Like that this has been a shorter experience than maybe your time without pain. So that's how I might address the trust issues. And then what are signs that a patient's pain is being amplified by emotional cognitive factors? I mean, every kid's pain is getting amplified by emotional cognitive. I mean, I cannot think of a kid in my 13 years where like emotional factors played no role because pain and emotional and cognitive factors ping pong back and forth all the time. You're going to have feelings about having pain, and your feelings about pain can affect your pain, and then your feelings outside of pain can affect your pain. And this is true for other bodily functions that are not pain related, like GI issues, like having butterflies in your stomach or twitching eyes, like those emotional and cognitive or sleep or other things can affect your body. And so the signs are that you're human, um, that's going to happen. But there, I would say like there's some kids that are more heavily psych, where if you're thinking about that biopsychosocial model that we talk about, where there's biological, psychological, and social parts to your pain, sometimes people lean a little more heavily in one of the categories. And so, if someone comes in with premorbid anxiety or issues that have lasted way before their pain started, then we know that, that they're primed, right? That they're like at a higher risk maybe for pain and emotional factors to interact. I hope I answered all your questions. I kind of spoke fast, but anyway, use what you want and hopefully this helps. I will hopefully hear from you soon. Bye.